Wisconsin's aging population will only increase the strains on health care in the next decade. There's already a need for more health care providers, and some worry how it affects the quality of care for Wisconsin families.
Sarah Maslerdona is digging deeper into what's being done to grow the health care workforce so patient care doesn't suffer.
Access to health care is a fundamental need, but within the next 10 years, experts say that need will grow dramatically.
What's really become clear is that the silver tsunami is here. It's here to stay.
The Association of American Medical Colleges reports between 2017 and 2032, the nation's population of people 75 and older will increase by 75%. And here in Wisconsin, the Department of Health Services says that in 2010, there were 780,000 residents 65 or older. By 2040, there are likely to be more than 1.5 million. That's an increase of 100%.
That's just staggering.
The Wisconsin Hospital Association is also tracking the impact baby boomers will have on health care in its latest healthcare workforce report. The association's vice president, Ann Zank, says the rapidly aging population isn't exactly good news for the healthcare industry, which is already strained.
We're seeing patients have to spend unnecessary days in the hospital waiting for a place to be discharged to. And some of those gaps are due to the shortage of nursing assistants and other entry-level workers.
And care needs will grow by 30% in the next 10 years. The WHA says increasing the need for even more nurses, doctors, physician assistants, and other specialized providers. That's part of the reason Madison College has a new year-long program for licensed practical nurses, or LPNs. Associate Dean of the nursing program, Ernest Williams, says that job is becoming more vital, especially as patient care gets more intense.
So when you think about having enough nurses, having enough physicians, at the right level of care, the patients may not be able to receive the level of care that they need to get out of the hospital on time.
Williams encourages students to diversify their options so they can fill in where there are gaps in health care. For example, advanced practice clinicians can step in to provide care when there are physician shortages. The WHA's report says the healthcare workforce is growing, though.
And that's really helped keep the pace of demand.
The Wisconsin Center for Nursing reported state nursing programs graduated 3,000 people in 2016, and that number's increased to 3,500 in the year since. Zank tells me since 2009, hospitals in Wisconsin have doubled the number of advanced practice clinicians. That includes nurse practitioners and physician assistants.
APC workforce is expected to double again in the next decade.
Growing, but not fast enough.
Well, I think we have to be creative. I think we have to be creative because we do need to grow. So it would be the process by which the grow is implemented.
In Madison, Sarah Maslerdona, 27 News.
Last month, Governor Evers vetoed a Republican bill that cut the number of training hours needed to become a nurse. He said that could have jeopardized care for the elderly and people with disabilities.
Supporters said it could have eased the shortage of CNAs in nursing homes.